The field of anesthesia pain management is designed to help alleviate patients' symptoms of discomfort, pain, with the objective of getting them back to a functional state as quickly as possible. Spinal cord stimulation, again, has been a technique that has been around for a considerable period of time, but unique to this area, and not just the Illinois area, but the St. Louis area. We are now able to deliver minimally invasive lumbar paddle leads to the epidural space for better control of back pain. The significant advantage of that and unique advantage of that approach here is that you are better able to offer stimulation to the spine and obviously better able to control pain. And to my knowledge, no one on the Illinois side and very, very few people on the Missouri side are offering that technique at this point.
Dr. Rowden's a good designator. So he sent me to the spine doctor to see if I needed neurosurgery. He said, no, I didn't. Try the pain clinic and it's done real well.
Dr. Anderson started with the injections in my lower back. I hardly felt anything, and it was great. And it has alleviated a lot of my pain.
Very commonly, patients will have issues where they're not sleeping, they're having more pain, they're having some other issue that may not allow them to progress as quickly in physical therapy or in surgery or in some of the modalities that I offer. The major advantage that we have here is that if that then is the case, the physical therapists, one of the spine surgeons, one of the orthopedic surgeons, or myself, we can very quickly contact our colleague and possibly even on the same day gets patients in to have those issues addressed.
It's a great facility. I know I've talked to Dr. Schultz about physical therapy, and now they have a physical therapy program at this new building, which also has the water therapy. And I've been to physical therapy before at other places that has not had the water therapy, and I'm looking forward to it. If they were going to go to the pain management program, Dr. Anderson is fantastic. Everybody in the program takes excellent care of you, and if there's any questions that you need answered, they'll gladly answer them to you.
I have a personal family member that was treated in a major institution here in the St. Louis area with relatively significant health-related issues, Parkinson's disease, and she had a relatively simple problem, and that was that she was having difficulty relearning how to walk properly. And it took their system approximately 6 months to respond to her injury. She in that interim fell, I believe, 3 times, suffered a hip fracture, relative to an issue that relatively quickly could have been resolved and could have been addressed had she been able to get into appropriate therapy. She's been treated here now, she's doing great. We've been able to collaborate with services in terms of aquatic therapy and physical therapy and injection techniques, and she's almost back to normal with no consequences.